Hi, Dr. Adam Goldman of the Metropolitan Vein and Aesthetic Center. I would like to talk to you today about spider veins and the treatment known as sclerotherapy. Spider veins are quite common. Up to, in some studies, 88% of women experience them before the age of 50, and even men up to 79%. And it's probably one of the most common problems that we see people seeking treatment in the Metropolitan Vein and Aesthetic Center. So I'd like to go over what the preparation for the procedure is, what to expect, and the aftercare. And so let's go ahead and get started. So the preparation is fairly simple. Basically normal bathing. There is bacteria that live on our skin, and with soap and water, we reduce the counts of the bacteria, which reduce the risk of infection. So important, just bathe normally. Number two, if you are prescribed any medications, for your blood pressure, for your thyroid, if you're prescribed blood thinners for a clotting disorder, it's very important to take these medications and continue them both before and after the procedure. The risk of bleeding is minimal, and if they were prescribed, we do want you to take them to prevent any complications. Number three, if you did take an aspirin or Motrin, which is technically a blood thinner, or an Advil or naproxen, there's no real risk of bleeding. Small amounts will not cause a problem, so we can go ahead if you did take it with the scheduled procedure. So the first step is the skin is cleaned with an antiseptic, and next we can start. So basically what's done is that there is a tiny needle, which is a 30 gauge needle, which is used by diabetics, for example, to give themselves insulin daily and other injectable medications. So it is not a very painful process. However, we will need to use that needle many times to inject the vein. So first we go ahead and start inserting the needle into the vein, and then we start injecting the sclerosant. So in our clinic, we use predominantly polydolcanol or glycerin, but there are many agents that could be used. We find that the risk profile and the effects and results are superior in our opinion. The sclerosant is actually mixed with an anesthetic. So once we start injecting, you will feel the initial pinch, but then you will feel a numbing effect. So this is done, and we start usually at the bottom of the leg, at the ankle, and move our way up. And we go into quadrants. So first on the inside of the leg, then the front of the leg, then the side, then the back, until we've injected all of the veins. It is very important to inject the veins carefully, because you need to be inside the lumen of the vein, and sometimes these veins are as small as a hair or smaller. So you have to be very precise when you do the injection to get any kind of real results. This is sometimes an uncomfortable procedure, and in another video I will go over strategies to minimize the discomfort. However, I will discuss that further later on. Let's continue with what to expect. So once the procedure is done, we give the leg a final clearing, and then we go ahead and place an ACE bandage. We recommend you wear the ACE bandage that day. You sleep with it overnight, and the next morning you take it off and shower normally. And then you want to go ahead and put the compression stocking on. So compression stocking is very important to help clear the veins after the procedure. So we usually recommend at least a week of daily use of the compression stocking. The healing of the veins takes some time, sometimes 4 to 6 weeks. So if you are very motivated and you had a large amount of veins, it is a good idea to wear the compression stocking even longer, anywhere up to 4 weeks, and it will help. However, at least a week is definitely indicated. You may resume all your normal activities. However, you should avoid strenuous or sweaty is the most important exercise after the procedure. Also, you don't want to be immersed in water, such as tub bathing or swimming, for the first 3 days. There is a higher risk of infection, as we've kind of inflamed the skin and made a lot of little holes. So we don't want the bacteria on your skin to enter through the water or through the sweat. So avoiding those things the first 3 days is very important. After 3 days, everything is pretty healed up, and you can go ahead and do any activity, including sweaty exercise, without a problem. So after the procedure, you may find you have a little discomfort. It's not very uncomfortable. However, sometimes it feels a little sore. So taking either Tylenol, Motrin, aspirin, Advil, naproxen, any one of those medications should work. And generally the pain or discomfort is very minimal. Sometimes you may notice some swelling. It's very important to use compression stockings for that, as well as you can elevate the legs at night or when you're lying down to help drain the fluid and help speed the recovery process. Now, what to expect? It does take time for the veins to reabsorb by the body. So the first thing you may notice is you may notice that the veins have not gone away. And that is normal because they are closed, but they're still there, and the body will slowly remove them with time. And the legs in general heal very slowly, so expect at least 4 weeks, but even sometimes 4 to 6 weeks to see the final result. Number two, the body sometimes wants these veins there. So the first thing we'll do is, at least temporarily, try to grow in some inflammatory veins around where we've injected. So if you notice sort of a red, very fine spider-like web of veins after the injections, is not uncommon, and most of these will resolve. I generally recommend wearing the compression stockings for additional time if you do see this, which will help resolve the problem. Now, after the 4 to 6 weeks, you will see the final result. Sometimes, as I said before, the body really wants those veins there. So even though you remove successfully the vein by injecting it and closing it, and the body's taking it away, the body grows in a new vein right next to where we had the original vein. And these often, as I mentioned before, look a little different. They're usually finer, they're usually more red, they can actually almost look like a bruise, and it's called neovascularization. So let's go over what you can do about these spider veins. So it is normal for even the most perfect injections to remove approximately 70 to 85% of the veins that are there. And similarly, you may notice some neovascularization in areas where the body has grown in new veins. So it is not uncommon that one series of injections is not enough to remove the veins. So after the 4 to 6 weeks, what you do is look at your legs, and if you're happy with the results, if there's minimal veins, then you don't need to do anything further. If you do see that the veins are still not cosmetically acceptable, or you have grown in some new veins, then you can go for a second set of injections. And very rarely, there are some small spots that no matter how many times you inject them, that the body still grows them in. This is the minority of cases. However, sometimes I've seen that after even 5 or 6 injections where you successfully injected the vein, it tends to regrow. Unfortunately, that is a process that occurs that we have no control over, but luckily it happens very rarely. Now, the important thing also to remember is that the veins will continue to grow as long as you're alive. So just like your hair, your nails, the process that caused the veins in the first place, such as standing upright, gravity, hormonal effects such as in a woman, pregnancy, menstruation, etc., these processes do not end. So it is normal to expect that some veins eventually will come back. The veins probably grew in very slowly to begin with, and so often it will take a very long time before you will start to notice a significant number of veins. However, this procedure can be repeated as many times as needed. So if you do notice the varicose, or the spider veins rather, coming back, please come back and we can always repeat the procedure. So once again, if you're experiencing spider veins and you would like to find out what you can do about it, please come see us for a free consultation at the Metropolitan Vein and Aesthetic Center, and we will discuss with you your options for treatment and what to expect. Thank you.